Hello guys, this is my vlog 2 on skills and capacities in the weight room. This video log will compare two people doing a squat variation. One squat will be limited by a lack of capacity, while the other squat will be limited by a lack of skill. What is a skill and what is a capacity? Skill is the capability of the neurological system that allows us to utilize our capacity to complete the task in the most efficient way possible. Capacities are the structures and general functions that moderate the system's response. This allows the athlete to achieve the most specific objectives. Such qualities would be strength, cross-sectional area, and mobility. Skills are learnt, capacities are developed. We are firstly going to look at an athlete who has the capacity to lift the 20 kg barbell but lacks the skill and coordination to efficiently front squat. The female athlete in this video has limited experience using the front squat technique in her training career, and as you can see in this video, she definitely has the capacity to complete the front squat with regards to sufficient strength. But as you can see, there is quite a lot of discoordination with horizontal displacement of the trunk and excessive forward lean. Firstly, I asked the athlete to slow the squat down using a 3 down 3 up tempo movement in the eccentric and concentric phase, focusing on transferring her weight posteriorly towards her heels while remaining a full transfer of weight in her full foot. I also used a visualization strategy on focusing on a specific point in the distance in order to develop an upright torso. She found this a useful technique in helping understand the movement strategy I wanted her to utilize. Finally, I used a video of an athlete performing a proficient front squat and showed this to the athlete, which I feel would help her understand visually what the movement should look like. Again, this is another strategy I feel helps athletes who have a skill limitation. In order to confirm that this athlete had a skill limitation and not a capacity limitation, I used 3 simple tests to confirm this. Firstly, I used the overhead squat movement and the active straight leg raise, which are both tests used in the FMS protocol. I also tested her dorsiflexion range of motion using a knee to wall test. I used Dartfish to allow me to look really closely at her movement, which allowed me also to develop specific and accurate coaching cues. Now I will show a second exercise that would highlight a skill limitation. This client struggles with coordination when I introduce the bench press. I will show in the video that she possesses the sufficient strength as she is well able to successfully complete a full bodyweight push-up. I have again used coaching cues, visualization and visual demonstration using Dartfish to help her understand the moving strategy that I want her to complete. After using specific cues and especially a visual demonstration, the client now has a much improved technique using the bench press. This again highlights how simple specific cues, visualization and visual demonstrations can help athletes who have a skill limitation to develop a higher level of movement proficiency. Now we will look at a client who has a capacity issue completing the front squat. In the videos, I use the overhead squat, single leg squat and loaded front squat with a power bag to highlight the capacity issues. The reason for the significant weight shift to her left foot is a previous ankle injury on her right foot in the previous 12 months. She has a clear limited dorsiflexion coupled with a fear avoidance. The client shows a clear quad and knee dominant movement pattern. This is a signal of posterior chain weakness and shortened soleus. She has an eccentric limitation in her soleus. This is acknowledged due to the bent knee position. Looking closely at the side view of the squat, you can see that her glutes are unwilling to take the activities placed in them. You can also see her heels are elevated, which again confirms the shortened soleus and the eccentric limitation of her soleus. Next, I loaded the client with a 15 kg power bag. This again showed poor glute function, especially the glute medius and minimus. Inversion of the foot is also evident here, and poor function of the tibialis posterior would lead to this instability. The second weight room exercise I used was the single leg squat, which I feel is a great exercise test to highlight capacity or skill limitations with clients. In this video there's a clear capacity limitation and evidence of knee valgus and thigh adduction and very prominent instability problems on the left and right side. Knee valgus would be a combination of instability and glute deficiency, and thigh adduction would be directly from glute med deficiency. The client also shows torso lean, pelvic rotation and pelvic tilt. These are all capacity limitations which could be developed with specific programming. Now I will go through a very simple initial corrective program strategy for client 2. Firstly, I will get my client to do myofascial release for 3 to 5 minutes. Following this, I would set a sequence of hip activation exercises such as frog pumps, hip thrusters, single leg and double leg, crab walks and mini band openings to activate the glute med, max and minimus. Secondly, I would develop a thorough mobility program specific to the areas that limit our ability to efficiently move, such as dorsiflexion range of motion. Finally, I would develop a strengthening program initially with bilateral exercises such as deadlift and box squats, and then progressing to single leg hip thrusters, split deadlifts and split squats, which would develop unilateral strength in the hip and limit what we see in the video such as valgus and thigh abduction. This program would help develop strength to improve her ability to correct the capacity limitations which we see in her movement pattern. To summarise Athlete 1, I would concentrate on firstly fine-tuning her skill of the front squat movement, using strategies already mentioned such as good coaching cues, visualization and visual demonstrations using Dartfish. Once I am satisfied with her movement strategy, I will increase resistance to develop capacities such as strength and power. I would also like to highlight the athlete is not only deficient in skill, but also deficient in her knee dominant strength capabilities. But currently the priority for this athlete is to develop skill and coordination and practice efficient squatting. To summarise Athlete 2, this client actually has a very visible capacity limitation, mainly strength in the glutes and spinal erectors. The priority here is to focus on developing strength, firstly bilaterally and then unilaterally, to strengthen the lateral hip complex musculature. Once her strength has developed, I feel very confident that her ability to demonstrate an efficient squat will improve. I would use a 1, 2, 3 in single leg stick test to see if valgus and thigh abduction is being positively treated.